Hi folks, Dr. Bob here again. We're working on basic chronic diseases and just helping you get familiar with some terminology and just understanding of a little basic pathophysiology. And at this point, we've worked our way through cardiovascular disease, and we talked about cancer and diabetes and kind of focused on a lot of metabolic diseases. And I'm going to start to work through some of the other organ systems. And so I'm just going to start with the digestive system. And I think probably, depending on time, we're going to talk about liver, gallbladder disease, and diseases of the pancreas. So you'll have some familiarity and understanding with these diagnoses. So the liver is a very important organ. It has a huge amount of very vital functions. I'll give you the basics of them real quick. So the liver is the main detoxifying organ of the body. Anytime you eat something, the first thing it passes through, or at least the molecules absorbed from your intestine, passes through the liver. So the liver gets a crack at that blood and whatever you put in your body first round. It is also very important in digestion because it produces the bile salts, which reside in the gallbladder and are pushed into the intestine to help emulsify fats. And it's very important in some other capacities. One of the very significant functions that it has is to produce albumin, which is a large protein molecule that circulates in the blood and is the number one molecule responsible for a thing called oncotic pressure. Now, oncotic pressure is the term used to talk about how water, which is what most of your blood is made of, is held by this albumin molecule, and it kind of keeps the fluid within the vascular system and not leaking out into the tissues. So those are really three really big main functions, again, to review: detoxifying, producing bile for digestion, and producing albumin to maintain our oncotic pressure. It is an organ that we cannot live without. It is one that has tremendous regenerative capacity. You can just about kill it and it can come back to life, but you can completely kill it and you will die or need a liver transplant fairly rapidly. And there are several different common pathologies that can affect the liver. Now, as we know, a lot of these things are related to behavioral. There are certainly autoimmune diseases and you got unlucky diseases that can affect the liver. But by far, the two most common things to cause liver damage is toxins, and the one that most people put in their body is alcohol, and infections, the hepatitis. So we'll go over those real quickly. So many toxins can cause liver damage. Some can cause acute liver damage, like Tylenol overdoses that could damage the liver and cause complete failure and irreparable harm, requiring an emergent liver transplant or death. Tylenol is a dangerous medicine when used in overdose. Treatable as long as you present early. But alcohol and other toxins can cause a process called cirrhosis. So though the liver has tremendous regenerative capacity, if we abuse things like alcohol chronically, we are slowly scarring the liver, this process called cirrhosis. Now, the danger of cirrhosis is, well, it's manifold, but obviously as the liver loses its capacity to detoxify, we start to have buildup of evil humors in the blood. As the liver loses its ability to produce albumin, we start to get leaky into our tissues. There's increased risk of the condition called edema, something we talked a little bit about in congestive heart failure. From another problem, increased pressure in the blood. So if we increase the pressure in the blood and we don't have this sucking capacity that albumin causes that keeps the fluid in the blood, we really start to leak a lot of fluid. So as we replace our liver with scar, that damage is permanent. When you replace the tissue with scar, we can't undo that. There are some issues that occur due to this, beyond just the loss of those two important functions. The scarring will start to cause an increased pressure in the blood vessels that are drained through the liver, the gastrointestinal tract, and we get a thing called esophageal varices, which can cause life-threatening gastrointestinal bleeding, and we can get bad hemorrhoids, and we can get bleeding into the intestines as well. And I guess I did leave out another huge function of the liver, which it produces clotting factors. So we start to see evidence of an increased ability to bleed because we do not have all of the necessary clotting factors in our bloodstream for proper ability to prevent bleeding. And so that's another massively important role of the liver that will result in significant problems for a human being if the liver starts to fail. So again, alcohol, pretty simple. Excessive use, linear effect, you will eventually damage the liver. I've watched in my ER career hundreds of people slowly die from liver failure, and it has to be one of the most miserable things ever because of this issue where the pressure inside the abdominal cavity blood system, all these veins that are draining the intestinal system are passing through the liver, which scars, and the pressure's increased and the albumin's low, so the oncotic pressure is decreased. They start to develop a condition called ascites. It's quite miserable. The fluid is filling up inside the abdominal cavity. The fluid can become infected and create immediate life-threatening problems, but it causes a significant issue with their ability to breathe because it's pushing their diaphragm up. It's just one of the most absolutely horrible things to watch ever. And I tell you, I've seen people with advanced liver disease to the point where they're developing ascites and generalized edema in their body, and they still drink. I mean, alcohol is a powerful drug that has reinforced behavior, and it's sad to watch a person kill themselves with it. So be mindful of your alcohol consumption. The second process that probably is as likely to cause the very same constellation of things I just discussed is cirrhosis caused by hepatitis. Now, the hepatitis A is a very common hepatitis. It's very equally transmitted fecal-orally, meaning foodborne, basically. People that don't wash their hands and serve you food can give you hepatitis A. It's generally a mild viral-like illness. In most people, they never get yellow. They never develop the typical findings of liver failure called jaundice. They never even knew they had it. If you test 40-year-old people in the United States, 50% have antibodies to the hepatitis A virus. But the other two, hepatitis B and hepatitis C, are more difficult to contract. They're considered blood-borne pathogens, and they usually can also be transmitted through sexual contact. So the most common way that these organisms, these viruses rather, get into the bloodstream is through IV substance abuse, again, a behavioral issue. If you get both alcohol and one of these chronic hepatitises, that is a double-edged sword that will destroy your liver quite quickly. So I hope that explains a little bit about liver disease and cirrhosis and the importance of the liver, not only from its ability to detoxify the body, its ability to produce bile salts, which are necessary for digestion of fats, its ability to produce clotting factors necessary for us to be able to properly repair injuries inside and on the outside of our body so that we don't bleed to death. And obviously, we need to keep a healthy liver. And of course, that important role of maintaining our oncotic pressure so that we don't become leaky, because that is a really horrible situation, regardless of the etiology, meaning the cause. The liver concentrates bile in a gland called the gallbladder. And though there are some genetic predispositions and behavioral predispositions to gallstones, and some medications can be implicated in the production of gallstones, this little sac that holds onto bile can form small stones that can clog the exit duct called the bile duct. This little duct can send bile into the intestine just below the connection to the stomach so that when you eat a fatty meal, a signal is sent to the gallbladder, which is a little muscular sac, to squeeze and pump some bile into the intestine to help break down fat for digestion. If there are little stones in the way, you can plug off this little duct, create increased pressure in that sac, a condition called biliary colic, which causes extreme pain and generally will have you in the ER with us scratching our head on a differential anywhere from any particular abdominal catastrophe to a heart attack. I've seen people that I thought were having heart attacks and they ended up having biliary colic. If the duct remains clogged long enough, you can have a process that is life-threatening called acute cholecystitis. That means an infected gallbladder that has to be taken out emergently. It's a dangerous condition. In general, if you develop biliary colic, meaning recurrent upper abdominal pain, this pain is generally in the right upper quadrant, which would be about, the gallbladder lives about right there. There's a tendency to have tenderness there during an attack, permanent tenderness if you have an infected gallbladder. And if you develop this condition and we do an ultrasound, a non-invasive test, and see those gallstones, which shadow the sound and we can tell there's gallstones in there, you are about 70% likely to eventually need your gallbladder out emergently. So I always was of the recommendation of once you have symptomatic gallstones, you go see the guy with some hard steel to fix that problem. Gallbladder surgery is fairly minor surgery now. Most of the time, if it's a non-infected gallbladder, you don't have acute cholecystitis. This organ can be removed very slickly with a laparoscopic procedure, a few small poke holes in the abdomen. The surgeon uses tools, removes the gallbladder, and it can actually be done as an outpatient. Now, people sometimes don't even have to spend the night if they're pretty healthy. So there's your gallbladder disease in a nutshell. Again, not trying to cover every aspect of the workup. You know, when I see a patient in an ER setting that has the right upper quadrant pain and I determine they have gallstones, there are markers by ultrasound and by blood to help me determine if there's a chance it's infected or not. If I think it's infected, that's an emergent surgical referral. If I think it's just gallstones, careful patient instruction, avoid fatty foods, warning signs for what to present for if you start to have fever and symptoms of obvious infectious illness and more persistent pain, and generally fairly urgent referral to have it removed. Now, there's another condition that can be caused by having gallstones. Sometimes these little stones can pass into the duct and get stuck. And it turns out that the way the anatomy is, the gallbladder empties through the common bile duct, and along the way in this common bile duct, another duct comes in, the pancreatic duct. The pancreas is another digestive organ. In addition to be very important in our endocrine function, produces insulin, it produces a lot of digestive hormones, including hormones that break down proteins and break down carbohydrates. And so once again, the pancreas is being sent signals when you eat to squirt some juice into the intestine. If that stone happens to lodge in the duct beyond where the pancreas resides, where that channel, that pancreatic duct dumps into the common bile duct, we see a condition called pancreatitis. So this would be called gallstone pancreatitis if that condition occurred. And the pancreas, because it has powerful digestive enzymes, if all of a sudden the pressure increases in there, the enzymes ooze out into the organ itself and the pancreas becomes inflamed. And here again, this is an organ you cannot live without. There are other ways to damage the pancreas. The most common cause of pancreatitis is behavioral, once again, and it's alcoholism. Alcohol can cause a condition called alcoholic pancreatitis, and extreme discomfort, generally more in the upper abdomen, oftentimes will radiate straight through to the back, and that pain associated with pancreatitis is severe. Patients will generally make it to the ER due to the discomfort. The treatment at that point, obviously if there's an obstruction, is to resolve that. We do have techniques, but it's emergent surgical referral. The treatment for non-gallstone mechanical pancreatitis, like alcoholic pancreatitis, some medications can be implicated also, is to rest the gastrointestinal system. And usually we admit those patients for pain control and for IV fluids so that they don't have to eat, and we hope the pancreas cools off. So that covers a few of the important digestive organs and some of the major maladies that may affect them. And I hope that just this kind of reasonable talk has enlightened you a little bit about those, and of course should help you to mitigate behaviors that might increase your risk of having any of these issues. I did leave out one other important cause of pancreatitis that is not as common as alcoholic pancreatitis and probably more common than gallstone pancreatitis, which is pancreatitis associated with high triglycerides. Now, it takes really high triglycerides to do that, and probably most human beings with a bad enough diet, particularly a really high carbohydrate, high glycemic diet, can achieve significant hypertriglyceridemia to the point where you can get pancreatitis. Some people have a genetic disposition to hypertriglyceridemia, and we have medication to treat that, but you do have to be careful. I've seen triglycerides in patients of 600 and 700 in my wellness practice, and then hopefully they get a little bit of religion, and not just the most important religion, which is the love of the Lord, but religion of taking care of this beautiful vessel that God gave you, and they turn around their negative dietary habits. And I have seen those people consistently maintain triglycerides below 100. Now, I will tell you that I have seen people who have bad familial hypertriglyceridemia, and the only way I can alleviate that problem is through certain medications. All right, so we covered the liver and its major functions and issues, the gallbladder and the understanding of biliary colic and acute cholecystitis and infected gallbladder. And we covered the pancreas and the mechanical obstruction of the pancreas causing pancreatitis, and the two other major causes of pancreatitis, which are drinking too much alcohol, which is 100% behavioral, and high triglycerides, which in many people is almost all behavioral, and some people have a genetic predisposition. I'll take a break. This was a little long. I wanted to talk about diseases of the stomach and intestines next. We're getting really close. I think I have left after that. I want to discuss at some length kidney diseases. So we'll kind of talk about the urogenital tract, things like kidney stones and urinary tract infection. And we'll probably have to put the prostate into that discussion. Hopefully give you guys a nice overview of that. And then we will cover the final chapter, what you get if you don't die of any of the other maladies. You don't get a heart attack, a stroke. You don't get an infectious illness that kills you. You don't get cancer. You live to a ripe old age. You're going to be fighting frailty, and we'll talk about that at some great length because we certainly have strategies to avoid that. So I hope you guys find this sort of just nice overview to be useful so that your newfound knowledge, which isn't power unless you turn it into action, will help you to expect success. Thank you very much.